Hello everyone, welcome back to my channel. Today's video is all about MD Psychiatry, its career prospects, its scope in India and abroad, and also what you should understand before taking psychiatry as your branch. If you are a NEET PG aspirant confused about choosing your specialty, then this video is for you. Why psychiatry? Now, psychiatry is one of the fastest growing medical specialties worldwide. There is an increased awareness of mental health, there is a rise in stress-related disorders, depression, anxiety, substance abuse, and all these make psychiatrists more in demand. With modern treatments, psychotherapy, neurobiology, and integration with neurology, psychiatry has become a dynamic and evolving branch. Before you take psychiatry, you should know the nature of work. Now, psychiatry is more of an outpatient clinic-based than ICU or emergency-based branch. It requires patience, it requires communication and counseling skills. You spend more time talking and listening than doing any procedure. What are the type of patients that you will see? You will have patients who are suffering from anxiety, depression, bipolar disorder, schizophrenia, dementia, substance abuse, child psychiatry. And these patients usually improve slowly, so long-term follow-up is very common. Then the third point is lifestyle and work-life balance. So psychiatry is one of the few branches which is offering a relatively good lifestyle with less night calls, less emergencies, and predictable working hours. But a very important thing that you need to understand is that emotional resilience is important because you are dealing with sensitive and difficult patients. Then, now another very important issue is social stigma. It is still present in India. Some people undervalue the importance of mental health. So as a psychiatrist, you will often need to fight the stigma and educate the society. After completing MD Psychiatry, you can join academics, you can join medical college as faculty, assistant professor, associate professor or professor, and then you can teach the MBBS MD students. Then you can join a clinical practice, you can join a government hospital, private practice, or start your own clinic. You can start your own OPD, you can get associated with de-addiction centers, rehabilitation centers, or counseling centers. You can work in a corporate or a private hospital because there's a growing demand for psychiatrists in a multi-specialty setup. After MD Psychiatry, you can go for super specialization, like there is DM in addiction psychiatry, DM in geriatric psychiatry, DM in child and adolescent psychiatry, DM in neuropsychiatry, and there are fellowships in psychotherapy, sexual medicine, or sleep medicine also. You can work with ICMR, WHO, NGOs, and work in research. You can work in corporate sector and have your own corporate wellness program or work with occupational mental health NGOs or some government programs, right? You can associate with schools and you can work upon children, child psychiatry matters, stress management during exams. So there's a lot of scope in India for psychiatrists. It's not just that you work in a medical college or a corporate hospital. You can do so many other things. What is the scope abroad? Now abroad, there's a huge demand in US, UK, Canada, Australia, but you need to require to clear the licensing exams like USMLE, PLAB or EMC, and mental health professionals are amongst the most in demand doctors in developed countries. What is the salary? Now, starting salary after passing MD Psychiatry, you get approximately 1.2 to 1.3 lakhs as SR in a medical college. You can also start working in a corporate hospital, and there usually the starting salary is 1.5 to 2 lakhs per month in India. With private practice, with your own setup, you can earn even higher. If you talk about salary abroad, then it is much higher. And there's a much higher earning potential due to shortage of psychiatrists. Importantly, job satisfaction is very important if you are passionate about mental health. My final piece of advice on this topic before choosing psychiatry, ask yourself, do you have the emotional stability, emotional balance to listen to other people's problems and give solutions? Are you comfortable with long-term follow-ups rather than quick fixes? Do you have empathy, patience, and communication skills? If yes, then psychiatry can give you not just a great career, but also a fulfilling one. Thank you for watching. I hope this video helped you understand the scope and career opportunities after MD Psychiatry. If you are a NEET PG aspirant, then do comment below with your doubts about different specialties and I'll make more videos for you. Don't forget to like, share and subscribe for more NEET PG and career guidance videos. See you in the next one.